Hello everyone. In this presentation, we are going to see in detail how to remove the gutta-percha from the root canal system in an easy and a very predictable way. There are many circumstances in our clinical practice where we would have done a root canal treatment, and because of some known or unknown reasons it would have failed, or it may be a case which was referred from some other clinics where you may have to do a retreatment of an obturated root canal system. So let's go into this video, and it's going to be a very simple to use technique which you can easily incorporate in your clinical practice in order to do root canal retreatment. The first step in a root canal retreatment is to do a proper evaluation of the radiograph. In this example, you can see that although in the first look it might look like a well obturated root canal system, but if you look carefully, you can see that in one of the mesial canal, you can see a canal which is a gutta-percha which is quite short and which is not extending to the full length. And you can see that even in the distal canal, you can see that the canal is quite wide. Actually, this is from an young patient and it is quite a wide canal, but only a minimal preparation has been done, especially in the apical region. And let's consider that this tooth has failed or the patient is having symptoms. And on radiographic examination, we have come to a conclusion that this root canal treatment could have been done better, or we could do it better, or we can correct the mistakes. If you cannot make out what is the problem, then you should never attempt retreatment. There are many circumstances. The root canal treatment may be well obturated, but you may think that it could be the problem, but the real problem may be there could have been a fracture or there could be a periodontal problem. In those situations, doing a root canal retreatment is not needed, or it's not going to improve the clinical situation. Here, first step is we have to confirm that this tooth requires a root canal retreatment. After confirming this, we have to follow certain steps. The first is to create an unhindered access to the root canal orifices. After that, we have to use solvent. In this presentation, I am going to explain about the solvent technique for doing root canal retreatment. There are different techniques. We can use H files, we can use heat, there are different techniques, or there are techniques where there is no need for solvent or heat, or directly we can use some files. But I feel that this technique of using the solvents is the most reliable, is the most easy. And then after adding solvent, you have to wait for some time, and then you can use a rotary file. In this technique, we are not going to use any hand files for removal or creating a pathway while doing GP removal. And then we have to repeat the steps like adding solvent, wait, and using the rotary file for GP removal. And once it is done, then we have to remove the residue. It will not come out everything completely. We have to remove the residues, and then we have to examine with the help of a radiograph for a complete removal of the gutta-percha. Let's proceed into this step. So we can see that the preoperative view, and first step is we have to remove the coronal interferences. That's the coronal restorative material, or if there is a post, it has to be removed. Whatever it is, it has to be removed so that we can gain a clear pathway to the root canal orifices. After that, you can see I will go through a small video clip, and I will explain what are the things which I am doing. So we have to see a good view of the root canal orifices. Then I am going to add a GP solvent. This solvent is going to soften the gutta-percha. Adding adequate quantity of solvent is also essential. Here I am using RC Sol, which is meant for gutta-percha and to dissolve zinc oxide eugenol sealers. This is quite a very inexpensive GP solvent. There are different brands which are available. There are different GP solvents which are available depending upon the sealer that you are using. It is whether it is a zinc oxide eugenol or it's a resin sealer. Depending upon the type of the sealer that we have used for obturation, we can use, and if it is referred from some other clinic, it's very difficult to know. After adding solvent, we have to wait a minimum of 2 minutes and a maximum of 5 minutes. 2 to 5 minutes we have to wait for the solvent to actually soften the gutta-percha. Then you can use a rotary file to remove the gutta-percha. And whenever you can see some visible gutta-percha stuck on the rotary file, we must always clean it with a cotton. Then only we have to use. Otherwise, the gutta-percha which is stuck in the rotary file can pose more problem to the file or more stress to the file, and it can lead to file separation. Here I am using a high flux remover. This is a single file gutta-percha removal system. Actually, according to the recommendation, we need not have to use a solvent while using this file, but here I am using the solvent. So all we need is a single file. So that's a single file removal system. I feel that this file is quite it is quite a good file for removing gutta-percha. Maybe comparing the cost, it may be pretty expensive compared to some other file systems which are available, but I feel like that there are no need for using multiple files, and with a single file, in most of the cases, we can get to the apical part without any trouble. So we have to continue to remove the gutta-percha. While doing cleaning and shaping for a regular canal, we usually use a brushing stroke, but here for GP removal in retreatment, we will use a pecking motion. That is, just you will push the file to some extent. Unless a stress is felt, then you will remove it, and you have to do the same or repeat the same until you reach the root canal apex. You can see that we get some chunks of the gutta-percha which are quite dissolved. Okay. What you have to understand is, once we are adding solvent, the GP solvent can dissolve only gutta-percha for around 2 to 3 millimeters, nothing deeper than that. So once you are using a file to remove or go down deep inside, then more of the solvent also go deep inside. So it is going to be a slow process, not like a cleaning and shaping procedure. It is going to be a slow procedure where we have to wait. We have to, if the gutta-percha, you are not able to remove the gutta-percha with a file, then you have to wait. Let the solvent soften the gutta-percha. And after that, I am using a small cotton pellet to remove the debris and the collected content in the axis. Why can't we use an irrigant? Because the irrigant, for example, let's keep it is sodium hypochlorite. It is going to dilute the solvent, and it's not recommended. We have to wipe it away, and after doing that, we can still see so many remnants of the gutta-percha over there. You can see the remnants of the gutta-percha. Still, you have to add fresh solvent, wait, and you have to repeat the process. Is it an easy technique? Yes, it's quite easy. Only thing is, we should have patience. If you are trying to remove the gutta-percha in a simple lump, and it may not work. So you have to work a little by little, and you should not apply excessive force while doing this procedure. We have to be applying a pecking motion at the same time. Maybe the pressure that is exerted while you are holding a pen and you are writing. So again, I am repeating. You can see that this time you can see less debris compared to that previous one. So again, I am adding solvent. There may be a question which you may get. Is it essential to add this much solvent? I am adding more solvent. Yes. If you are adding less solvent, what happens is the solvent will make the gutta-percha to a semi-solid consistency. If it is in a semi-solid consistency, the file may get stuck inside the softened or a semi-solid gutta-percha, and it might apply an excessive force and the file may get fractured. So that's why we are adding. Is adding solvent a very good technique? Actually, telling the truth, solvent can cause apical problems or it can cause periapical problems. So in order to remove the debris, I am taking a 15 size hand file and I am taking a small wisp of cotton and I am rolling it in a file to remove it. So this is going to be a very easy, cost-effective technique, and I need something which is quite firm so that it can go up to the apical area and it can remove the debris. Shall we use a paper point? I think that paper points are not that sturdy for removing this. And if you are using this technique, you can see that there are a lot of lateral spaces and we can use smaller files or you can customize it and you can remove most of the debris from the root canal system which is left over there. Paper points I prefer. The one more advantage of using this is, in this cotton pellet also, if you find there are some debris, you can add little solvent in this cotton and you can wipe it over the canal wall so that even the debris or the remnants which are present, we can remove it easily. So we have almost removed the gutta-percha and you can see that the root canal orifices are almost open or it's open. So this way that you can remove the gutta-percha easily compared to any other technique. So after finishing that, after removing that, I have taken a radiograph and you can compare the pre-treatment and after treatment. You can see that there is quite a lot of amount of canal straightening and it might look like a wide canal because the mesiobuccal and the mesiolingual and the distally also there are two canals, the distobuccal and the distolingual. They are overlapping, giving such a wide canal appearance. Actually, it is not that wide, but you can definitely appreciate the canal straightening. With retreatment, canal straightening is quite common because most of this instrument which we are using for gutta-percha removal are quite aggressive instruments because it has to cut through the gutta-percha and also any obstructions which are present. So they are quite aggressive instruments, and maybe using the solvent may go beyond the apex and it might cause some periapical irritation. That's common, but that's a risk that we take while doing. So the alternative techniques are we can attempt to use heat and our H files in order to remove that. But the problems are if you are using small hand files for doing this technique, even the hand files may get fractured and it may get caught inside. That's one of the problem. And the second problem is you may remove in chunks and pieces, and sometimes some of this gutta-percha may go beyond the apex. Small pieces may go beyond the apex also. So if you are using it in a curved canal, then solvents are the best. And if you are using in a straight canals, and the heat technique or the H files and the heat application may be a good way of removing gutta-percha. For example, for a central incisor, you can use that technique. But from curved root canals or from especially from molars, the usage of the solvents is the most predictable way of this. So after removing the gutta-percha, if you want, you can enlarge with the rotary files to some specific size and then you can go for obturation. So after removing with removing the gutta-percha, you must irrigate well with a solvent, with an irrigant solution like a saline or even sodium hypochlorite to remove the solvent completely. Especially use lot of saline so that even in the periapical region, if some solvent has gone, it will get diluted and it can be removed easily. So leaving the solvent unremoved will cause periapical irritation and can induce a periapical lesion. solvents are quite caustic material, so use it cautiously. But if you have decided to use it, use adequate amount of solvent and not stingy, because if you are using less solvent, it can lead to file fracture. And I have attempted different files for doing retreatment. This one is quite an efficient file. So know about your practice and whether your technique for removing gutta-percha in the comments. And if you want me to make a video on the heat technique and the H files for removing gutta-percha, let me know in the let me know in the comments. I will make a video on that. I hope this presentation is of some help for you. Thank you for watching. Thank you for your subscriptions, and I make more and more videos. That's mostly because of your enthusiastic comments and your eagerness in watching most of my videos. Thank you for watching and keep watching. I will make more videos. Thanks a lot.